Welcome to the Repro Files, where infertility meets injustice and nothing is off limits.
We're two nurses. We're certified reproductive health advocates, and we're here to tell you everything they didn't.
From the broken systems to the heartbreak left behind, we're here to connect the facts, the policies, and the pain.
Because silence isn't safety, and we're done being quiet.
This is the Repro Files.
Infertility, injustice, and all things nobody warned you about. Welcome back to the Repro Files Podcast, where we dive deep into infertility, injustice, and all things nobody warned you about. I'm AnnMarie.
And I'm Elizabeth. We're so glad you're here for another week of honest conversation at the intersection of reproductive health with policy and justice. And those things, I think we would be remiss if we didn't address kind of the week's news.
So yeah, we're starting today's episode with a heavy heart. I mean, gun violence is again devastated another community, one of which was the Annunciation School in Minnesota, the other in Colorado as well.
Yep. And then in just a few months ago, we saw Democratic lawmakers, Melissa and John Hortman, gunned down at their house for their political beliefs. We saw the two children at, as you mentioned, the Annunciation School, whose lives were tragically cut short. Fletcher Merkel was 8 years old, and Harper Moisky was 10 years old. And my children are practically 8 and 10, or 7.5 and 11. Ever since the gun violence in El Paso, my heart has been heavy on this topic, right?
Yeah, I agree. I think Columbine was the first time that really hit me hard when that happened. You know, I think about parents whose kids are in school now. Mine are both out of school now. So I'm kind of like, when graduation happened, I was kind of like, wow, I'm glad they're not having to go back to school again. That's a
Yeah.
good thing. And that's terrible to be thinking that. You know, these kids should be in school learning anything, English, mathematics, reproductive health. Instead, you know, they have families that are grieving losses that never should have happened.
Ever. And we won't mince words here. Political violence is wrong, full stop. Against the right, against the left, against either side, by the left, by the right. It does not matter. It is not okay. And I think the heaviness in the hearts, I think everybody's hearts are heavy. And part of what is the cause of that heaviness is it seems as if we care more about the political assassinations than we do the children in schools that go to school 5 days a week, wondering if today's the day.
Yeah.
And I was in a conversation with a group of folks here in Gilbert at a wonderful civil discourse meeting that was hosted the other night. And somebody brought up a really heavy point. And that point is it's far more than maybe what you and I did when bomb scare, like bomb threat drill type of things, right? My daughter, when she was in kindergarten, that's when the El Paso shooting happened. Dropping her off every day. And still to this day, every day I drop my children off, I study their faces and I pray that they come home. And gun violence is not simply a crime issue. It's that and it's so many different things. And we want to place blame instead of looking for solutions and unifying, using this horrible moment to unify one another, right? But gun violence isn't just a crime issue. It's a public health issue. It's shaping whether families can raise their children safely and whether parents feel secure sending their kids to school. And I'm here to tell you that, kids having to wonder and look around and say, should I save my friend? Should I save my teacher? Should I save myself? You see kids writing their names and their phone numbers on their arms in the middle of communities need to thrive. And under that type of threat, we are creating a generation of children with PTSD. We like to, again, point a lot of blame on the why. But I do believe and know that the constant daily threat of gun violence is traumatizing our children.
Yeah, it's, in actuality, we have more in common with each other than things that we don't. And I think that needs to be brought up more and more, and people need to shout that more than anything. We do care about the same things. maybe we believe in different ways of doing things, and that's everybody's right to be able to do that. You know, yeah, I think you made a good point. Gun violence is a public health issue. It is the number one cause of children's death in the US. That is unacceptable. More than
That
cancer, more than anything, that is unacceptable. Very unacceptable to me. That's why we're here, because reproductive freedom doesn't mean anything if we can't even bring our kids home at the end of the day.
absolutely, absolutely. And from so that we just wanted to get that out there, that we see you all, hear you all, we feel the heaviness that you feel, and if we can take one thing away from this week, it is that if we all leave our homes today to wherever the places that we go, and we look for ways to unify and not divide. We look for, as you mentioned, the things we have in common. 8 out of 10 Americans agree on all the hot button issues. Believe it or not, 8 out of 10 Americans agree on, and maybe I'll correct myself, I won't say all, but a good majority of the issues. What we've done instead is we have shifted to minority rule. And so, from the gun violence situation in Minnesota, we want to sound another alarm. And that is that there is an infant mortality emergency happening in Mississippi. The state health department has declared a public health emergency over infant mortality. The numbers are staggering. There are
Yeah.
9.7 infant deaths for every 1,000 live births. Basically 10 babies per 1,000. That's the highest infant mortality rate the state has seen in more than a decade. And since 2014, Mississippi has lost 3,500 babies before their first birthday.
That's a crisis right there. The state, I mean, at least they're starting to talk about solutions. They're looking at building OB systems of care that would standardize and regionalize maternal and infant care, while making transfers between hospitals more efficient. I get that, but that also
Yeah.
takes money.
Yeah, I mean, and when you yeah, absolutely, and we instead of adding money to our healthcare system, we've taken money away, a significant amount of money. In fact, the single greatest transfer of wealth from the poorest in our country to the richest in our country. And you brought up a good point, and that is that at least they are talking about solutions. I get a little testy when people say, "Well, they care now." You know what? It's better than never, right? And so one of the things that Mississippi is talking about, and it's bringing the conversation up in the national stage, is that we need to eliminate these OB deserts. And what we mean by that is there are, so many of us who live in suburban America do not understand the toll that it is to grow up or to live in or to raise a family in or to give birth in, et cetera, et cetera, et cetera, et cetera, in places that are rural that don't have care. So we've got patients that drive hours to get to an OB. That's not acceptable. So we do need to expand prenatal care through county health departments. We need to strengthen home visiting programs like Healthy Moms, Healthy Babies, and scale up community health workers. There are social workers, lactation consultants, you name it. There are so many community healthcare workers that are ready to take an honest go at solving this problem. But again, we have to come together to do it.
Yeah. Yeah. And a lot of people that I know that went into social work, they want to help people. It's a system problem that they're not able to get to everybody. The state, they're already trying to address preventable deaths as well, like with safe sleep education, something as
Yeah.
simple as, the baby sleep environment can totally make a difference. I remember when my firstborn, when she was being born, it was back to sleep, right? That was the thing. And they even
Back
released
to
a,
sleep.
like, not to you weren't supposed to have babies sleep with blankets anymore. They had those little zip up blanket thingamajiggies, and I was like all in on that one. I totally had that.
And those safe sleep measures saved babies. They
Mhm.
saved babies. I used to be a labor and delivery nurse, and we had a number of protocols that babies, there was a time where would be a lot of infant head injuries in the postpartum unit. How does that happen, right? So she's just given birth. She's exhausted. Everybody is shaming her about breastfeeding if she chooses to do that and how hard it is. She's exhausted. So what does she do? She falls asleep with her baby.
Falls asleep.
So
Yeah.
we had a huge initiative back in the early 2010s, I'll say, where we as nurses took specific steps, not just to educate patients. And this was in an effort too that we did with the community OBs, because you need to know you you need this information given to you over and over again. And so the point
Mm-hmm.
though is that here's the issue. None of these solutions actually really matter at all if people can't afford their care. So if we've got
Right.
hospitals that are closing, that keep closing maternity units, and we know we've talked about this in other episodes that the healthcare cuts coming to the Medicaid program are going to disproportionately affect people in rural and lower income areas. In Arizona alone, the birth rate that's covered by Medicaid is around 50% of births. And so if we pull money out of the system and especially pull it out haphazardly, we keep closing maternity units, the Medicaid expansion remains blocked, policies and politics matter. And this is where I say, actually, we all should care about politics. The climate of the last 10 years has convinced people to shut it down, right? I don't do politics. But here's the thing, politics is everything. Politics is having the right road signs, keeping your roads in good repair. Politics is your school systems, your hospital systems, your social safety net systems. Politics is everywhere. And
Yeah.
yeah, I mean, politics is everywhere.
Yeah. Well, speaking of that, Elizabeth, so speaking of the politics, in a different state this time, in Texas, they're once again pushing the boundaries of what lawmakers can legislate, and especially when it comes to reproductive health. So, have
Yeah,
you heard of
no.
this one?
Yeah, the Texas legislature, just like the Arizona legislature in the last fall, Arizonans overwhelmingly voted for the right to reproductive freedom, abortions up to 15 weeks. More people voted that proposition into law than voted for the current administration. And yet they turn around instantly and the legislature starts finding all these ways that they can backdoor it. So the Texas legislature has passed House Bill 7. And this law allows private citizens to sue people who manufacture, distribute, or prescribe abortion meds to or access.
And not only that, if they're successful, they can win $100,000 in damages. If they're not related to the fetus, they get 10%, and the rest go to charity of their choosing.
This
What?
is
What?
so
Excuse me. What?
women themselves can't be sued, I guess, nor can women who take the medication after miscarriages. But this, let's be very clear here. This law is 100% designed to terrorize providers, pharmacists, and even people that might mail medication into the state.
That's a whole nother layer of like vigilante style enforcement that we saw with Texas's 6-week abortion bans. It's privatized politicizing of healthcare. I'm going to talk well today. And it sets a dangerous precedent for the rest of the country.
It
And,
does. I mean,
yeah,
think about the situation in Georgia with Georgia is one of the most aggressive states when it comes to their heartbeat law. And as a result, a woman named Adriana Smith was kept alive based on that Georgia heartbeat law, HB 481. The hospital cited that as the reason for keeping Adriana alive despite being brain dead. She was 9 weeks pregnant when she experienced a medical emergency of some kind. But because the hospital cited the anti-abortion law, they kept her on life support and used her body as an incubator against her will. Against her will. And like you said, it's complete privatized policing of healthcare, right? And we
so yeah. And I kind of just want to say something now. People may come and it might be controversial what I say, but since she has passed away, have we heard anything about the child? And I think my point is saying that, like, it was more important when she was pregnant as opposed
Yep.
to right now when that child is going through immense medical observation care.
Yeah.
probably going to
And
be in the hospital for years, not years, but months, or maybe never leave the hospital. We don't know.
yeah.
Who's going to take care of this child and all of their needs? We have no idea. And it seems to have just dropped off of the news reels. It's not out there anymore.
Yeah, I think you make a really, really, really good point, and that is that what is the cost of these things? Because it seemed, like you mentioned, it seemed a lot more important to folks when she was pregnant. The spectacle of it seemed to overshadow the really dark reality of what was going on. And as you mentioned, I think tying it back, and then we will kind of shift again to the next crazy thing in the news. But before we do, I think it's very similar to what we talked about at the top of the show and what was going on this week. We choose to use specific things as political weapons. Two children will never escape the vicious killing of their father on video. That is all over the internet. It should never, ever, ever been allowed to circulate at all.
No,
We should have more
never.
decency than that. So those two children, that's what they'll know of their father. We, it doesn't matter at all what you think or if you care about the specific person itself. A woman is grieving the sudden loss of her young husband. Again,
Hmm.
all of that is it should be the overarching signal that we need to make the
That should
shift.
be the story. That should be the story.
Yeah, and I mean, I deeply believe that this could be a turning point,
Hmm.
truly, that we could look around at one another and say, guys, there's so much more that unites us than divides us. And let's focus on what we agree on and start there. Right. So Texas, though, is not, of course, the only state making headlines. Back to South Carolina, not only did, Georgia, I guess, we've got Texas,
We're
South
just
Carolina.
gonna go move
So
through the
South
states here.
Carolina lawmakers, so they're having a grand old time in their legislature advancing Senate Bill 323. I know you're very familiar with this, known as the Unborn Child Protection Act.
Yeah. So
Sounds great, right?
yeah, on paper, it's a fetal personhood bill. Now we've talked about this in a previous episode. It would define embryos and fetuses as persons under the state law.
Right. And that means that not only abortion, but potentially IVF, other assisted reproductive technologies, these other things could be criminalized or severely restricted.
Exactly. If embryos are treated like full legal persons, then discarding unused embryos or even managing embryos during IVF could be seen as homicide. That's terrifying for patients trying to build families, and it's already a stressful time in their whole lives about having to go through infertility, thinking about IVF. Again, going back to thinking of people who are working on building families. They are desperate for families. They want it. This is their dream. They've been doing the, 6 months to a year of unprotected intercourse. They've gone through, oh, my thyroid is a little wackadoo. I'm going to fix it. They've gone through all of these other things, checked everything, done testing, and still they will need. And again, we're that's just the heterosexual couples. We're not talking even about the homosexual couples that need IVF to have a family or IUI, any type of assisted reproductive technology.
Yeah.
But you know, again, I think about those people, the patients who are trying to have a family that this is their dream. But then you also think about, and we talked about this before, what about the doctors? What about the REIs? What about the embryologists? Are embryologists going to be sued if embryo, right? If a morula doesn't become a blast? Now,
Right.
I know a lot of people don't know what morula and blastocyst is, but it's the stages of an embryo growing. Now,
Can I nerd out for a second?
you can totally nerd out.
Sweet. I appreciate this.
This
Thank you.
is a nerd
This is a
zone.
nerd moment, right? So, and it is very important because we do want to be very intentional with our words and help people. We are, as nurses, we want to educate you all on the nuance of this, right? an egg and a sperm come together, and certain group of folks want to say that that is life, right? Okay, but cardiac cells beat in a petri dish. Okay, when I was an undergraduate, when I was in, we had a science lab, and the methodology of teaching at where I went to school, St. John's College in Annapolis, Maryland, very great book school. All of the students refer to each other as Miss and Mr., and they do the same to the professors. So there's no teacher. We're all each other's teacher. And so in science class in undergrad, I learned about the cardiac system by actually culturing a chicken egg into a beating embryo, right? That's not a chicken. Okay. So again, cardiac cells beat in a dish. That is not indicative of life, because if it were, many people wouldn't have had to settle on being child free, right? And it's not just theory when it comes to this. Bills like these, unfortunately, they create a chilling downstream effect. So back to the nerd science of it, an egg and a sperm, they come together. That doesn't even mean anything until the next day when we see, did those two cells coming together create what are called two pronuclei or 2PN, or we can look at the embryo under a microscope and say, this is a fertilized egg. Okay, step one. A couple days later, we expect that embryo to have morphed, if you will, or grown into what's called a morula. And a morula is typically what it comes out around the third day of fertilization. And you see, looks kind of like a solid little ball. There's multiple cells in there, and those cells are coming by rapid division of that fertilized egg. So it kind of resembles like a little mulberry or something of that nature, but it comes before the blastocyst stage. And the blastocyst stage marks a really crucial step before the embryo really starts differentiating itself into, here's the inner cell mass. This is going to become the fetus. Here's the trophectoderm. This is going to become the placenta. Again, I did ask for permission to nerd out. I'm almost done. Right. But that is a critical step. So many labs they'll check fertilization the day after, embryo egg retrieval. And then they'll look again on day 3. Not everybody does. A lot of folks say, you know what, let's just leave them be. But we know that not all eggs will fertilize. Not all fertilized eggs will develop those two pronuclei. Well, all fertilized eggs by nature would have two pronuclei, but not all of those 2PNs develop into morulas. All of those morulas do not develop into blasts. There is a steep attrition that happens during the process. So it's really, really, really important to be intentional about that, to understand that no, if a blastocyst is not a baby. A blastocyst is got the recipe for a baby, but there's a long way between blastocyst and baby. So because of this, providers now second guess care. There are absolutely patients, I've spoken with them, who said, Elizabeth, I don't feel safe pursuing this treatment right now, but I'm 38. When will it be safe again? Will there be any time left for me, right? So patients delay treatment. And then a whole field of medicine like reproductive endocrinology, one that scientists and providers and nurses and doctors and embryologists and people everywhere have fought so hard to dig into, and that gets under.
Yeah. Yep. And I always, when I was learning reproductive, health, when I started working at a fertility clinic, one of the first things that did strike me as, yeah, you're right, is they said a blastocyst is potential for life. Potential for life, right? And we all know, just going on the coattails of what you just said, because not every blast is going to implant for multiple reasons. And some of those reasons are just unknown. And yeah, so
Like
I
the
think
math
you've made it.
typically looks like this. Let's just do the math for folks. I just want folks to understand IVF math. Okay. Let's say you get
Yeah.
20 eggs out of an egg retrieval. So those 20 eggs came with like 10 appointments, probably 30 shots, 5 ultrasounds, 5 sets of blood draws, right? And we got to an egg retrieval, we were able to get 20 eggs. Not all of those eggs will fertilize. So let's say that your partner has super sperm. One of my doctors I used to work with, Dr. Amos, would say, he had this joke about even Superman himself only has 6% morphology or something like that. But so he loved that one. I had fun telling it too. But so if you get 20 eggs, maybe 16 or 15 fertilize. Of those 15 that fertilize, maybe only 12 of them make it to day 3, the morula stage. Of those 12, normal attrition at, let's say you're 35, those 12, you could be down to 6 that make it to the blastocyst stage. Of those 6 that make it to the blastocyst stage, not all will survive the freeze and thaw. Not all will be genetically normal, will even have the right recipe. So I love that you said that potential for life, because while it is a recipe, it's still not, there's a long between blastocyst and baby. It's a long journey. And so you may end up, as I did with my IVF cycle, we only had 2 even potentially usable embryos out of 26 eggs retrieved.
Wow. Yeah.
That's not wildly uncommon.
Nope.
It's pretty
Yeah,
normal,
you're right.
actually. So when you think
Yeah.
about a fertilized egg as a baby, right? There's just such a long distance
A
between those 2 things.
long way.
Yeah.
Yeah.
Yeah. But we can shift. I know we are moving on to all the hot
Yeah.
topics
So
and all the
let's
hot
switch.
states. And that brings us to your home state, ma'am.
Yeah, let's switch states up and come to my home state of Florida. So that's in the spotlight again. I know this happened, a little not too long ago, but the Surgeon General of the state of Florida said it's time to roll back vaccine mandates. So that was interesting to
Yeah.
say that. When it was announced, I don't know if you watched the news conference, Elizabeth, but
I did not.
it was done at a private school, and when they announced it, there were cheers. Like, people were cheering, 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 and they were so happy about that. And I was just kind of like, had a face of like shock, like, what? Where they already have the option to opt out of vaccines. There
Yep.
is religious exemptions available. People can opt out of them. The problem is, of course, herd immunity. I can go on that subject for a million years, but the whole thing is, what they are framing it as is parental choice. Okay. So here's my thing. Number one, this leaves families, less protected, schools more vulnerable, communities are more at risk of outbreaks. Hello, the state of Florida. We have a lot of older people in this state who are more susceptible to diseases, immunocompromised people. My first thing was, what about the kid who has cancer that just wants to be normal and go to school? They
Yep.
just want to be able to go to school with their friends. They have cancer, they're immunocompromised. They didn't even have to have cancer. They can just have some sort of immunocompromised, in any type of disease. They can't go to school now. That's what's going to happen. They cannot go to school because of this. My other thing about my home state that I'm going to talk about is this choice. And I love that they use that phrase. I love that they use the word choice. Choice.
Words
Let's all
matter,
think
right?
about that.
Yep.
What type of choice is that?
Well, yeah, when we frame it as a parental choice, and I certainly don't want to say that parents shouldn't have a very critical role in the deciding factor of sort of what happens to their children. At the same time, unfortunately, in today's age of the Google, a Dr. Google, if you've ever met him,
Google.
do not want to get sued, so let me stop saying that. But everyone is an armchair immunologist now and an armchair virologist, right? We have had 3 confirmed deaths in this country in this year. In 9 months, we've had 3 confirmed deaths from measles. We've had 400 kids under 5 years old infected with measles. And of those children, 92% were unvaccinated. So most of us in this country today do not remember iron lungs, right? Why? Because we eradicated polio.
Yeah. It's gone.
With a vaccine.
Or was.
Right. And I always remember just being in awe of, if you remember, trying to remember the gentleman's name, but he's, I think, one of the more famous people that was in an iron lung. And he had just such a positive outlook on life and, made the most of it. But is this what we're setting our kids up for? Because when you say parental choice, you're indicating that all parents have the skill set, the facts, and the ability to discern very complex medical information peer-reviewed studies, randomized controlled trials. These are things that epidemiologists and virologists and immunologists, these are the things that they are experts in. So when state lawmakers are moving to remove certain requirements and they're framing it as parental choice, that seems to set a pretty dangerous precedent that, what is the statistic of what percentage of people can even read at an eighth grade level? Okay. So when we were in nursing school, I don't know if you remember this, we were always taught to teach at or below a sixth grade level because over 50% of Americans read below a sixth grade level. So a 2020 Gallup analysis for the Barbara Bush Foundation for Family Literacy actually found that 54% of adults in the United States between ages 16 and 74 lack proficiency in literacy, which is equivalent to reading below a sixth grade level. So therefore, when you frame it as parental choice, people who we know do not have the tools that they need to sort through the data. So then it becomes politics over people, right? How can we spin it? How can we move it, right? And at the end of the day, this leaves families less protected. This leaves schools vulnerable. This leaves clearly communities are at more risk for outbreaks. Public health infrastructure is at risk because it only works when it's a collective, right? So anything else to add on Florida? They want to steal your thunder because
No,
the place
I
you call
think
home.
you said it, perfectly, is that we don't know what it was like to have a polio outbreak. There were parents, I've seen movies because I watch a lot of movies, but I've seen movies. Parents were terrified to send their children out to their community pools to during the summer times. They were terrified for, that because they were afraid of the polio. And I think that, yes, maybe some of the older generation remembers, but, they're getting older and we're losing that. We're losing that thought process of.
Well, and let's take a quick global kind of historical perspective look at it, right? Let's just zoom out for a second. Of 41 high income countries, the United States is the only country without guaranteed paid parental leave.
That is
Now, why
that
do I
is
bring that up?
insane.
Why do I bring that up? Because
Well,
we're
now
talking
you
about
go.
Mississippi losing babies at some of the highest rates in the nation. So the federal government won't even guarantee families a few weeks of paid leave to bond with their newborns. What do we think is going to happen, right? So,
Yeah, well, half of the people, or probably more than half, I think it's 40%, sorry, less than half, 40% of people are eligible for FMLA. I forget
okay.
the statistic, something like that. But it's a lot of people. Only certain people are guaranteed FMLA, right? The Family Medical Leave Act. So they can take up to 12 weeks of unpaid leave.
And
Unpaid.
only if they've been with that company for a year.
Correct. So how many mothers are out there delivering babies that have part-time jobs, that have jobs that don't provide PTO that they could utilize? For FMLA also, I believe you have to have a company larger than 50 people.
Yeah, there's a whole bunch of stipulations on it. And so many people aren't even, that's 12 weeks of unpaid leave. And even that is a ginormous struggle, right? And then on the lighter side, if we're thinking global, like looking at global perspectives, let's not, the US government spent a lot of money to destroy a very large amount of contraception. And that contraception was earmarked by USAID for underdeveloped countries where birth control is key. And we just destroyed it for fun. And so I always like to point out there is literally a museum in Amsterdam that is displaying 200-year-old condoms. And some of them even feature erotic prints. So
yeah. So that just shows that contraception, it's not a new thing. It's not like a shocking thing. It's not new. It's been around. It's been around since, like, I think the first mention of it was back in the 50s. Like, people been using birth control since way back then. It's the stigma and the politics around it that is a modern invention of
Yep.
this, and that birth control that was in that building that was destroyed, people offered to take it off of the hands of our government.
Yes.
Whether they paid for it or whether it was donated to them. That is wasteful and unacceptable.
It is, because to me, we talked about this a couple of other times. It feels performative. It feels like there's certain things that matter and we're going to amp that stuff up. And then there's certain things, and it's all about control.
Mhm.
And my thing is, I have a deep respect for patients and for people. And I think that whenever it doesn't injure or harm or risk anything to the people around you, for you to do the thing. So let's say you have a same-sex spouse. That's fine. That's your choice. If I don't believe in that, I don't have that, right? If you don't believe in birth control, don't use it. But don't destroy it for people who do need it and who do want it. And that's where, if we could get to a spot where we could elevate just sort of the mutual respect that as human beings we ought to have for one another, and that respect over somebody else's choice and autonomy. And I can hear it now. I can hear somebody saying, well, you said parents can't choose, blah, 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 right? It's about an empowered choice. It's about an informed choice. In medicine, we have to get what's called informed consent, meaning we have to discuss the risks, the benefits, the alternatives of a specific procedure with you to a certain level of satisfaction before you can even sign the consent forms. And it should be something similar. Like, if a patient is going to sign consent forms and a provider even sniffs a hint that that patient doesn't know what they're really kind of what they're signing, still has questions, still has concerns, an ethical provider will say, we wait until you feel comfortable making that choice. And so I think that there's so much more gray. And
Mhm.
if we would be willing as a society and as a people to look at what's going on and to say, we can do better, I think that starts with a lot of unity.
Yeah. Do better. That should
Do
be
better. When
our
you
thing
know
for the
better,
week.
you do better. When you know
Do
better, you do
better.
better. Yep,
So before we wrap up, Elizabeth, I know you have a big trip coming up.
I do. We're recording early this week. We'll still get out to you on the same day. But I am headed to Capitol Hill this week to meet with lawmakers. The focus there is going to be fertility care, so protecting IVF, expanding insurance coverage, and addressing some of the dangers of politicizing science and fertility care. So we'll be discussing restorative reproductive medicine as well, and the dangers that exist there if we don't clearly sort of suss out the nuance. So we're going to be there making sure that reproductive freedom in this country includes the right to build a family.
Which feels especially important, given what we just talked about, all of our states that we just followed up on, and South Carolina and fetal personhood laws, all of that.
Exactly. Reproductive freedom isn't just about avoiding pregnancy or ending pregnancy. It's about people having the choice to decide if, when, how, and with whom or with no one that they want to have a family. So we have to ensure that that full spectrum of reproductive freedom is protected. Everything from, as we've talked about on prior episodes, educating, our young people as they go into puberty, all the way to menopause and that end of the spectrum and everything in between. So we have to make sure that when people want to build families, they've got to be able, especially when 1 in 6 people in the United States is struggling with infertility. We've got to make sure that they can access safe and affordable care without interference and where choices are always between them and their doctor. And that is exactly what I'm going to fight for in DC this week.
That's awesome. So,
I will miss you the last great, well,
we
a
are
couple
gonna
trips
miss
ago.
you.
I've been making it out there about 4 or 5 times a year. I guess I'm getting prepared.
I've only been once, so I'm jealous,
And
and
that
I
time was
enjoyed
great with you. So I will miss you, but I will I will your energy with me.
Awesome. Well, we're going to be following your advocacy closely. We definitely want to share updates for our listeners. So I hope you come back with some good stories that you
Yep.
can
Keep
share
an
with
eye on our
us.
socials. We would love for you to
Yeah.
join this fight. So share this episode, leave us a review, connect with us on social media using our hashtag, the Repro Files. We are so humbled to have had such a wonderful reception to this information and this space to discuss these things. And so we'd love for you to join in that fight and as we said, share like all the things. But
Yeah.
until next
So
time,
I guess until that time, keep questioning, keep learning, and keep fighting for reproductive justice.
every day, all day. See you next week.